Sure, I've used the five ATs approach with a number of patients, and it's actually been a transformational experience. It's totally different than how we're taught to take a medical history, but it's a lot more informative. And I've learned, even using it on people that I've been seeing for a long time, I've learned a lot more from them and about them than I have the traditional medical way, where we identify problems and we tell them what they should do to solve their problems without really trying to understand. And once you get the full story of people about the struggles that they've had and the successes that they've had, you get a much better sense of where they're coming from, and you're much better able, I think, to help them. In fact, I think that's the key, is that quite often we try and fix things based on problems, whereas you realize that they have strengths and challenges, and you help them themselves, which sounds a little bit cliche, but it really works. So when we understand some of the emotional factors, the other factors, life factors that have led to conditions like obesity, it helps us appreciate where people are coming from and how they got where they are. And quite often people will have had successes, and we can point out to them, because quite often they don't realize themselves that they do have the ability, that they can do these sorts of things, and we can build on their abilities that they've demonstrated in order to achieve success. The other thing is then it becomes, they really have, I find, they get ownership rather than they have to do what I've told them to do. And there's no motivation behind that, but rather than when they've set their own goals and are working towards their own goals, something that's meaningful for them, they're much more likely to be successful. And you get a much better feeling out of it as well as a practitioner when you're helping them achieve something that they want to, rather than telling them what to do. So for example, it's really easy, and I guess traditionally we tell people, well, you need 150 minutes per week of moderate or more activity, which really doesn't mean anything. But one of my patients who said, her goal was to be able to spend an afternoon walking around the zoo with her niece and not having to sit every 10 minutes, being able to help her achieve that, gives you much more satisfaction, is much more meaningful and motivating to her than it is just to say, hey, you need to get 150 minutes of activity per week. When you start interacting with people using this technique, you do get a much more personal and different relationship than the traditional clinical type of relationship. We're using it clinical in the colloquial term and in the medical term, where it's sort of very sterile and you don't understand people and it's just an exchange of facts. But when you use this approach, as I say, changing the dynamics, people are much more likely to open up and tell you information that's really valuable that allows you to help them. I found out with one patient that I've been following for 20 years, for example, that she had been subject of family violence, which 20 years I had never known until I started to use this technique. And it was incredibly helpful to know, because we'd probably gone for another 20 years, if I practiced that long, without knowing critical information in order to help her. So having that relationship also makes it more of a discussion and less of an interview or a history taking, and I think it's much more meaningful to both parties. I understand people better, and I think they probably feel that they are understood much more than what we often hear about in clinical encounters. With a fast approach, it does take more time in the short term, and so you just have to schedule more time. But in the long term, I think it saves time, because you get where you want to get to, or you collectively want to get to, faster than if you just have innumerable visits of the person coming back and no, they haven't lost weight or they haven't changed a behavior, and you just have repetitive visits. Whereas if you understand and empower people, the increased time at the front end saves you as a practitioner time in the long run. But even more importantly, it's less frustrating for all concerned. So it's and it's not time that's misspent, or you're not looking at your watch. You're much more engaged with the person. It's sort of you become much more interested, I guess, in their story. And so the time passes quickly. So say you're not looking at your watch, wondering what's, when you're going to see the next patient. Absolutely, as the fast approach really has benefits to the practitioners, to the clinicians. So we talk about triple aim and quadruple aim. The fourth part of aim is improving provider satisfaction in addition to lower costs, better outcomes, better patient satisfaction. The triple aim, but provider satisfaction is important as well in this day and age where you hear all about burnout and boredom and such. This approach changes that. I find people are more likely to achieve their goals, and the goals are different. Again, rather than just saying you have to have 150 minutes of activity, and they come say, yes, I had 151 minutes. That isn't as meaningful as when they say, guess what? I was able to run my first 3 kilometer race, or to participate in a 5 kilometer walk, or to whatever, or I was able to lose 20 pounds, whatever their goals are, seem to be much more meaningful. And you get much more satisfaction as a practitioner in helping people achieve meaningful goals than achieve just targets or specific numbers. The FAST approach, I think, offers a tremendous opportunity in chronic disease management because, of course, by definition, the disease is chronic. And so people have these conditions that need to be managed and that they want to manage on a long-term basis. The techniques that been using till now are not that, haven't been that effective. It's, the old cliche, we keep doing the same thing and hoping for different results. And we fixate ourselves on achieving numbers. So whether it's minutes of activity or weight or a blood glucose reading or a blood pressure reading, it's not very meaningful and doesn't have the same impact as when people have very specific goals. So, of course, in motivational interviewing, as an example, we start to transition a little bit and ask people to identify goals, and FAST takes it actually past there as well. So there are the goals, but you understand what has led people to where they are, what their strengths are, where their weaknesses may be, and they too are able to understand that. So it's much more meaningful, and I think, in the long run, we're going to end up with much better chronic disease control than if we just fixate on the medical clinical approach. We also know that the emotional and the mental plays a huge role in people's physical state. So being able to address those through the FAST approach also will get us, if that's our goal, to those physical outcomes of better blood glucose control or weight loss or minutes of activity in the long run, much better than just trying to do the same old thing.